unknowingly ultimately can have a ripple effect on the state of your health. And that is why every Friday from 10:15 to 11 we try to engage with experts from different fields of medicine who join us to lend their voice to the sensitization that's currently ongoing when it comes to health and safety. And today's a particularly special day. It's a special episode because we're commemorating World Health Day. Now, typically it happens on the 7th. Out an opportunity to talk about why it is important to join the trend and lend our voice in our own little way to all the many stories that World Health Day pushes to us. It is celebrated every 7th of April every year, and this occasion sort of reminds us of the very importance of health and well-being for everyone, and especially in a world where we're striving for equitable healthcare across the world. We're trying to turn our attention to the issues that affect millions of people, inaccessibility to healthcare. And it's not just highlighting the challenges. We're also going to be talking about how to overcome these challenges. There are emerging leaders in global health, and they're participating in transformative action and solutions to bridge that gap that exists between a sustainable pathway that can uplift healthcare in undeserved regions. And so we're going to explore how these pioneering efforts are unfolding in Nigeria. We're going to talk about successful initiatives that have inspired change, that has promoted better health insights regarding healthcare access. We're going to talk about the complexities that surround these issues. Why is there such a very wide healthcare gap? And in all of this, we must celebrate innovators at the front line that are doing the best they can to improve public health. And lucky for me, I do have one of such innovators with me today. He is, of course, a PhD student on public health at the Wisconsin Medical College in the United States of America. His name is Godwin Okodwa. Good morning to you. I don't know what time it is there, but good morning to you. How are you doing today, sir? That's what we do for public health and safety. Yes. Thank you very much for joining us. I conveniently left out your middle name because I was trying so hard not to make a mess of it. I practiced. If that makes you feel better, I did practice, but then I felt like I wasn't going to do a good job and I just left it alone. Do you want to say the name for me?
Right. So my middle name is 𝐓𝐻𝐿.
𝐓𝐻𝐿. Okay, 𝐓𝐻𝐿. But I'll just conveniently leave it out so that we don't have a problem at the end of the day. But it's such a pleasure to have you, Godwin 𝐓𝐻𝐿 Okodwa. Thank you for joining us. Like I said, he's a PhD student on public health at Wisconsin Medical College, and we're going to have a conversation really about innovative public health solutions and how emerging leaders are shaping global well-being. And like I told you, this is of course in commemoration with World Health Day that is celebrated or commemorated annually on the 7th of April. So let's talk about you first of all, because that would help us understand all of the efforts that you've put forward when it comes to improving public health in your own capacity. So talk to us about all of this problem, which is inaccessibility to healthcare in a lot of regions. And
Right. So good morning, Lagos. Thank you very much, Madam Sage, for having me on this call. So to your question, so my story started, so a quick backstory. I had my bachelor's in for public health. Started was through various experiences in Nigeria where difficulty, people pass through sometimes very preventable issues, pertaining to healthcare, because of, various things, right? There are infrastructural deficiencies, there are population level dynamics. And so I began to think about a world where, people have equitable access to the healthcare that they need. I began to think about, a scenario where people would no longer have to suffer preventable health. Personal experiences began to drive me to do research, began to drive me into the realm of advocacy, with really just one goal in mind, ensuring that no one else has to suffer, from preventable things like, unfortunately, funding or due to a lack of accessibility to healthcare facilities. So essentially, it was a problem-driven cause. Basically, I'd seen these problems firsthand throughout my time in Nigeria. And I decided that, this was a cause worth exploring, trying to figure out the solutions to healthcare access problems, and ensuring that people live longer and their lives are not cut short by preventable issues.
And I was very intrigued by the utilization of antenatal care by young mothers and adolescents in Nigeria that was published in Discovery. of individuals, of mothers, right, lack reliable access to healthcare, and only 40% of the population has access to essential. Obviously, if you are working on bridging this because of the education level or disparity in education level, amongst other things, but or can you describe some of the issues that you identified when individuals unable to access the basic healthcare that they need, and in this case, even women and children who happen to form the most vulnerable in society?
Means.
Right.
So there are essentially 5 dimensions of access as proposed by one of my favorite researchers, 𝐓𝐡𝐞 𝐒𝐨 in their 1978 paper. And these 5 dimensions of access are basically availability out of access. That is, the care you need, is it available where you need it? And so, but again, ask about children need essentially a maternal clinic or a primary healthcare center or a secondary or tertiary healthcare center can be located. Let's use Lagos as an example. Imagine a person living in the interior part of Ikorodu, right, that has to go all the way to Lagos. Graphically, it presents a problem. The third, and I think one of the most important aspects of access is affordability. I can literally have a hospital in front of my house. But if I don't have insurance and I don't have the money to pay for it, can I actually say I have access? Probably not, right? And then the fourth dimension is acceptability. So many people in the studies that we've conducted so far, many people talked about how the nurse talked about, instances of nurses and even some, unfortunately, healthcare workers being rude to them, because they came to access care. Now, not everybody thrives in that kind of situation. Some people might just suck it in and like, you know what, yeah, we need it, so we'll just have to stick with it. But some other people can't. So if the healthcare service is available, if it's accessible, if it's affordable, but it's not acceptable, if you keep infringing upon the dignity and the rights of the people that come to access care there, can you actually say it's accessible? Probably not. And then the last dimension is accommodation, right? So essentially, if you have to have pregnant women waiting in poorly ventilated areas, places where they have to walk for miles to pay for one service here and then go line up in one service here and then go drop their card somewhere here, that's a stressor to the life of the pregnant woman and her child. And so some of these issues impact on the decision making of not just pregnant women, but even other aspects of the much more evasive issues that hinder people from accessing essential healthcare services, especially antenatal care and then facility-based delivery. So what we basically try to do is to bring some objective perspective to what's already known anecdotally, like saying, yeah, we know that there's disparities in access to maternal care, but hey, these are some of the issues that are driving it. And without understanding...
3 FM is your weekly health program where we, of course, discuss with leaders of thoughts in the health sector, and they help us to focusing on how emerging leaders can shape global well-being, innovative public health solutions, the emphasis on the solutions, because that is the end game of any conversation that we have on here. My name is Sage Babalola, and I'm having this conversation here with Godwin Edosawe Okodwa, who primarily on inaccessibility to healthcare amongst the many research that he has done to improve public health. Well, you had mentioned something about spending time in Nigeria, and now you're in the United States, and I say that because I'm true. And well, countries like the United States of America have made significant strides when it comes to healthcare. Of course, there's still room for improvement. Can you talk to us about the disparities that exist between, the health work is what I'm asking about, the impact of your work nationally, internationally, also how your work internationally as well has been able to help you to do well to participate. You can leave questions using the live chat option if you want to have questions, if you want to ask questions or participate in the conversation. You can search for us at Mainland 98.3 FM or via our official website.
I think there are a couple of different ways we can address that question. I'll begin with my work so far and try to draw a comparison and to also highlight some areas I think Nigeria can do things a little bit better. I think so far, I think we are not exactly doing things terribly. I think I have to give kudos to know where we need to be as a nation, as a giant of Africa. But again, we have to celebrate the small steps of progress that we're making. Okay, so what I do and how I do 3 key domains. One is in research and evidence generation. because we're in the era of evidence-based medicine, strong evidence backing your policies and programs. And one way we do this is through research. And so in the past 5 to 8 years, I would say I've conducted and been a part of several studies exploring key issues within Nigeria and the United States, one of which you pointed out earlier. And the key outcome of those studies has been hard, verifiable evidence, often objective, that sort of explains some of the phenomena we see and provides a sound scientific basis for healthcare planning. How young people, college students in particular, were demonstrating hesitancy to the COVID vaccine due to various reasons. But beyond all of this, we began to, also uncover pathways of influence. So, for instance, you can be educated, right? You can do your own research about the vaccine. But if your parents who have different political leanings or different educational levels, if they decide that, no one in the family is going to have this vaccine, right? Your chances of having that vaccine are slim. So we began to explore, student-led policy changes in the way vaccine mandates and vaccination campaigns are being rolled out on college campuses. So how does this relate to Nigeria? See, vaccine hesitancy is the same, right? And so while the underlying reasons driving this hesitancy might differ from, right, even up to now. In fact, if you go on the streets of Lagos today and you talk to people about the vaccines, the first you're almost always going to have this skeptical look like, what exactly are you talking about, right? Especially with all of the misinformation and the myths that went out, at the height of the pandemic. So basically my work, two other domains are actually with community engagement you have talked about earlier, and then health system strengthening in terms of it can be more both applicable in the US and in Nigeria, is that, you see, innovation doesn't always have to be the latest shiny new product or technology. That's great, but it doesn't always have to be that work. Right now I just finished a systematic review where I reviewed nearly 10 mutators to, again, better understand the problem and provide objective, verifiable evidence that can drive policy. And so to the last part of your question, if I remember correctly, on how, both social, how much time we have, there's a lot we can talk about. If I can just talk about two things, I think one, we need innovate the average Nigerian. Matter of fact, the sickness in Nigeria is not just a sickness. Depending on the severity, it can be a sentence, right? And that's because many insurance companies prefer to just stay with the low expense ailments, and then when things get more expensive, of course, almost exclusively relies on out-of-pocket payments for treatment related to chronic kidney disease. So that's the thing we need. I think for research, drive research, we need data, and to drive data, we need data mechanisms. I think there's an active registry in Nigeria right now that can actually, fuel research endeavors. And so I think those are tools for Nigeria. There's a lot more we can talk about that.
You had mentioned technology quite a few times, and also research. I mean, obviously, if you're going to carry out research, there's the place of technology and all of that, and even helping people access your research. It means that there would be the involvement of technology. And one of the problems that we have in Nigeria is that, yes, as much as we are very educated people, we still have a very large demographic that is not very educated. That still, aside from access to healthcare, there's also the inaccessibility to technology, to resources, amongst other things. Tackle healthcare problems in Nigeria and worldwide. So digitizing information for easy, not just Nigeria, right? Africa generally, we cannot overlook that. So on board with that particular movement in terms of technology. So if we are at a time where we are digitizing specific areas of research, that you would like more people to get on board with.
Yeah, I think that's a very important question, and capacity that we have in advanced nations where you have telemedicine thrive off of the basic infrastructural demands, things like stable internet, things like stable electricity, right? Things like, regulations, right? So in the absence of those foundational blocks, it might be tricky to have a properly institutionalized digital health approach driven by the private sector. We have lots of startups, I think, doing, really amazing work. But all of that would have to be scaled to be able to deliver real dividends as far as improved. There's a lot we can do once we have the infrastructural building blocks. Basically, for instance, these are systems that really can't afford to go out of power, for instance. These are systems, as far as the health system is concerned, until we are able to resolve the infrastructural situation. I think, for instance, one of the areas I'm looking at, especially with the use of AI, is in machine learning, and how that provides a platform for things like predictive analytics. For instance, you can predict outbreaks, you can predict incidents and prevalence. You can predict just had some of these AI-driven models in place. But again, they need the fundamental infrastructural, political willpower, and the right policies in place. We can achieve those things. But more than an eagle flying on one wing before, probably not. I say this because what our system needs right now is digitization, spatial distribution, and all of those stuff. The population level dynamics are often overlooked, and that could actually jeopardize every other thing we're doing on the other side. The population dynamics involve the interaction of the population themselves. Some really nice initiatives and strategies that were put in place, right? COVID happened during Christmas. They had to go home and spend Christmas with their families. Now, they weren't cleared yet. These were people that were still infectious. These were people that were still actively contagious, but yet they still insisted that, you know what, this is something we do in our family. We just have to leave this place. We're not sure what you guys are doing here. I know we appreciate what you guys are doing here. We understand this is probably something serious, but we have to leave, right? So there are attitudes, behaviors, and perspectives that people hold that, if not addressed, will be incredible as the work they do. People like Aproko Doctor, for instance, I think are actually leaning a bit more towards this, and they're doing incredible work trying to sensitize the people to ensure that we have both wings driving in the same direction. So to your question, we have a system is effective and functional and that we can improve health outcomes, but we must not forget the population.
Today on the program, he is a PhD student in public health at Wisconsin Medical College in the United States of America. We are commemorating World Health Day in our own way, talking about innovative public health solutions and how emerging leaders are shaping global well-being. Well, I guess we can very conveniently call him an emerging leader, and he has, through his many research and many works, been able to put forward material that is quite useful if we're addressing the issue of inaccessibility to healthcare. There's statistics that tells us how very alarming the situation has become, whilst also specifically, and I say this so that people can understand the kind of effort that goes into researching into the problem that you've researched on. So let's talk about some of your projects, some of the initiatives that you've worked on, how these data has been able to help you, what kind of scale. I understand that there's a precedent. Some countries, some areas need more attention than the others, but what are some of the notable works that you've done, some initiatives that your research have helped you put forward, and how...
Awesome, thank you so much. We are talking a few of them earlier with COVID-19 vaccine in the U.S. I currently have about 6 of them currently undergoing peer review. Should be going out any moment. So we had the COVID-19 vaccine hesitancy study and vaccination campaigns were being rolled out. I also in recent times I also designed a media campaign, and then I'm also conducting I've actually just finished a systematic review and also conducting other studies as well. So featured, in print, in the use work. My work has, as I said, also been published in peer-reviewed journals. And then I've also been, invited to speak at the APHA. And so essentially I've had lots of resources, first from my background, from my family, and then from my institution as well, the Medical College of Wisconsin, to clarify. I've enjoyed several scholarships running into, has helped shape me, it has helped shape my worldview, and it has equipped me with really, really, really critical knowledge. The problems we face cannot be solved at the same level of thinking that created them. So people would always have to think outside of the box. As far as your last question, the last part of your question about my vision for public health. Well, I envision a world where access to quality health care is a right because essentially there's a wealth of research evidence that shows that higher income morbidity and mortality compared to lower income earners. So essentially, the richer you get, the healthier you are likely to be. The research has shown that. So, but again, it just means that people who don't have as much income are disadvantaged by default, and that narrative has to change. So my vision is a world where quality access to quality healthcare is guaranteed by the constitutions and the provisions and the policies of our government, and not just a product or a privilege reserved for the highest bidders. I hope I addressed all the aspects of the question.
Yes, indeed you did. Let's talk about challenges that emerging leaders, I'll call them that, face in trying to drive solutions to the health problems that we have highlighted throughout the course of the program. I beg your pardon. I do realize the challenges you think there are to implementing these solutions, and to see exist between these different cooperation, so to speak, or these solutions. And also, like I said, it's a 2-in-1 question. What are the major challenges there are? You've done research, you have data, you've come up with a solution, you've come up with a strategy. What hindrances do you oftentimes, yourself and others alike, encounter in attempting to implement the solutions?
That's a really critical question, and you had touched on a couple of points that I wanted to share.
Right.
One of the challenges that we frequently face is regarding data availability. I think currently we have data might be available from. I have explored a couple of them in recent times, especially Nigeria-focused data, but my ease of use and it was really difficult. In fact, I'm still not clear as to where the data is coming from, or if the data source is actually valid. And one key issue that researchers like myself often face. So we have the tools, we have the experience, we have the expertise, but without data, we are handicapped. So that's one thing I think is. And then you have bright ideas that you want to implement as far as a program or a policy change or a strategy is concerned, but of the office you're going to meet with, how it's going to be like, and if your ideas will be received or not. You also want to, right? So you'd want to engage and collaborate with some of these researchers, but again, they do so much with so little, and so because they are typically always stressed, it can be difficult, and due to bureaucracy. And I think a third key challenge that I've seen in recent times is there was a project on ending malaria. I can't remember who it was by, but there was a project on ending malaria. They go home with free mosquito nets to address the malaria situation and all that. Now, that went on for a while until we discovered that some of those mosquito nets that were supposed to be distributed is quite unusual. There were rumors that it was some of the healthcare workers that went to sell them. There were rumors that some families, how that happened, but we know it did happen. And so that in itself, so you see what we're talking about, the population level dynamics. Right? So we have a strong in the long-term sustainability of some of the ideas and strategies that we come up with.
Governmental organizations, even amongst other things.
Yeah. Oh, right. So, to get the question, in what ways can either key stakeholders or everyone who has a role to play, the end community organizing is concerned, the researchers like myself have a strong role to play when it comes to conducting research and planning for programs, and then of course the federal, all the issues like that, and also things like religious leaders. You'll be surprised how many people believe they're at the table to say, hey, you together a framework that leverage to draw up a plan. So that way, we're not only bringing up a plan that is just having a vested interest in that project. So that way, we will be able to plan interventions that work and to also help address key issues for you guys. A lot of you go and sit down. Let's be done solving this problem. When we're done, we'll call you guys back.
Right.
No, we are all sitting at the table. There's a power share in the US. It's called community-based participatory research, right? Everyone sits at the table, and then we have a community advisory board from the local guy who has a talk shop at the beginning of saying at the communities and what are some of the ways we can help. So the NGO leader says, you know what, I know this, but sometimes it can feel very difficult for everyone to sit at the table without having a sense of superiority or without having a sense of preference. Because sometimes people have funding requirements, people have their own, reputations, people, tend to be suspicious of everything until it eventually turns through. So there is a lot of interest.
Well, thank you very much. We are actually out of time. It's been a pleasure talking to you. The conversation was in commemoration of World Health Day. We spoke about innovative public health solutions and how Adesawe Okodwa, who's a PhD student in public health at Wisconsin Medical College.
And 2027.
Great day. We appreciate you for the research that you're to make sure that regardless of social or economic strata pocket. Thank you very much for talking to us today. Have a fantastic rest of your day, and I hope that things work out at the end of the day. I should say, and lack of access to healthcare is a problem. We're stepping out of the studio very briefly so we can have our Muslim brothers and sisters have a great time on radio as well. 𝐸𝐼𝐼 Islam will be here at 11 a.m. At 12 noon, I'll be all the things that have happened over the course of the week, and would also have a guest join us briefly to talk to us about a conference. Stay tuned. It's Mainland 98.3 FM. Don't go anywhere.
Advertise with us at Mainland 98.3 FM, where you